And we on? Yes, we on. This is Let's Talk About Sex with Dr. Raj. And today we have a special guest with us, Mr. Prashant Maharaj,
Good evening, everyone.
because we're dealing with a very important subject, a subject that touches the lives of many individuals in our country, a subject that is very closely related to one's sexual being and general health and everything else. We want to feel good. We want to be good. So we'll be discussing diabetes, the effects that diabetes have, and the things that happens with individual when they are diabetic. Of course, we have different situations with diabetic. We have a pre-diabetic state. We have diabetes type 2 and diabetes type 1. And I've said it in the correct order because some people feel that diabetes type 1 is the less of the two, is the less of the two evils. But of course, this is an interactive program. This is a program that deals with all sexual questions. It does not have to deal directly with diabetes or any sort of illness. It could deal with any question that you have. If you have questions on anything that are sexual in nature, this is the time and place to do it. This is the station to call, 103.1, the first, the finest, forever. We'll get that telephone number out to you in a few seconds so that you can call it, you can WhatsApp. For those of you who have my private WhatsApp number, I did ask a few of you, I did ask my audience last week if you wanted to get in touch with me directly, if you want my personal cell number, and this is something a lot of people are surprised at, but I give out my number easily because I have no fear of receiving any calls or anything. It's 740-1961, 740-1961. All you need to do is send me a message, but make sure you put 103 so I know that you are a fan of the program. You have heard me on 103, so I can correlate the information and always send out a broadcast to you. For those of you who have my number before, I always send out these broadcasts ever so often so that you can know what's happening, all the different things that I'm involved in. I am involved in sexual health. I've been doing that for over 20 years now in Trinidad and Tobago. I've been very successful at it. I have a clinic in St. Augustine that deals with all sorts of sexual dysfunction. Anything related to anything medical, that's where I have to draw the line because I'm not a medical doctor. The doctorate that I have is a PhD. I'm a sexologist and sex therapist. For those of you who don't know, I know some of you may be listening to the program for the very first time. My qualification is applied health studies, a specialty in sex, gender, and sexuality. So I've been doing this for many years. And I think sex education in all form and fashion is very important. And the reason for that is that there are lots of individuals out there who have questions, but they have these questions and they don't have answers. And when they do get answers, sometimes the answers are not accurate. And if the answers are not accurate, what happens to you? You go out there with false information. When you have false information, you cannot do the right things. A person who has correct information on any aspect of their life can make an informed decision. It may not be the correct decision at the moment because things change, but it will be an informed decision. So many a times we are faced with challenges in our lives, whatever it may be, and we don't have someone who can actually tell us, well, this is the situation, this is what you need to do, this is the correct way of going about it, and all the different challenges, how to put it aside. So we need to look at that. We need to be conscious of those things. So let's deal with that aspect. So for those of you who want to call in, well, it's a WhatsApp number. You can send your messages via WhatsApp. We get it directly in the studio, 299-4103, 299-4103. And the telephone number to call is 628-4103. That number again is 628-4103. But we'll take a break now because we have online game results.
You want to do it? You doing it or I doing it? Me or you? Time now, friends, for your online game results. Courtesy Quartz playway number. First off is that number 5. The mark is pass man. It played with a white ball. Pick two numbers, 13 and 10. That also came with a white ball. Pick four numbers today. The numbers 1, 5, 6, and 2, and Cashpot with a multiplier of 4. Gave this evening at 7 p.m. the numbers 11, 7, 3, 16, and 8. Results came your way on 103 this evening, courtesy of friends at Courts. They have branches nationwide. Check them out.
Did you know that you may be
Hang on.
These suffer with aches, pain, stiffness, and other
Enjoy.
Studies show that you should replace your mattress every 7 to 10 years for better health, better support, and a better night's sleep. Visit a sleep center today at Courts and find the perfect mattress for you. Courts, bringing value home.
And we're back. So for those of you who have my Facebook account, of course, you can look at this program live on Facebook also. I know some of you do choose to do that, but of course, this is radio, Theatre of the Mind, but now we have cameras in the studio, so it's no longer Theatre of the Mind. You can actually see what's going on. So let me introduce my guest to you all. Again, this is Prashant Maharaj. And
everyone.
He's the gentleman that is going to fill us in some of the things that are being done at the Adult Therapy Center. But before we get there, at the Adult Therapy Center in St. Augustine, you can make your appointments to come in and see the doctor to deal with your diabetic problem, even find a cure for it. And we'll go into that a little bit because some persons are questioning this. But what I ask individuals to do, anything that I talk about on the radio, I make sure they have a consultation done so that they can get all the information firsthand as opposed to just getting information from me. In the past, I've brought scientists and doctors and whatnot from overseas to deal with different issues. We did augmentations and whatnot at the clinic. We had treated psoriasis. Unfortunately, the lady who used to treat psoriasis, she's from Cuba and she can no longer do it for technical reasons. We had persons who came from our clinic that I was affiliated to in Las Vegas. They came here to do stuff. We had local doctors who would work on persons with different ailments, different things. So the Adult Therapy Center does not only deal with sex, but everything related to sex or anything that could affect you as an individual. Because for you to feel sexy, for you to feel good about yourself, you got to be healthy. You got to think that in a healthy way, and you have to be comfortable so that whatever you may be doing, you feel good and you can actually get involved in it and not have problems. So Prashant, let's take it there.
Great. Good night, everyone, again. Just to give you some information on diabetes, a lot of persons tend to be confused as to what is diabetes. They've probably heard the term aha sugar before, or they may be experiencing some of the symptoms, which is frequent urination, constantly having numbness or tingling in the feet, and our favorite, problems in the bedroom. Yeah, diabetic patients, especially men, may actually suffer from erectile dysfunction. And let's look at, well, why that is. You have to keep in mind that diabetes actually affects your blood vessels, and as a result of the blood not flowing properly, your nerves are not nourished as well as they should be. So what we really look to do at the Adult Therapy Center is combine these two things. Combine repairing the blood vessels together with repairing the nerves as well. With that combination, we're actually able to have an excellent reaction, especially in the human body. A lot of persons are familiar with using B supplements to actually repair their nerves and nourish their nerves, but you find that the over-the-counter products tend to not quite be the best. That's why they tend to have higher percentages of daily amounts. These companies know that your body is going to break down the vast majority of it. So that's why they actually look at putting more so that they'll try to compensate. We really look at treating the entire patient as opposed to just, the problem itself.
Prashant, what I want the listeners to understand is no matter who you are, if you have a condition, if you have any sort of medical condition, it affects you in many ways. One of it is stress.
Yes.
Stress tends to deplete a man's testosterone when you have to deal with stress. Now, everyone has asked this question, what is testosterone? What is the importance of testosterone? And to put it in layman's terms, testosterone is what makes us a man.
I agree.
Men have testosterone, women have estrogen.
Plain and simple.
Simple as that. It's the difference between being male and female. That's why you have athletes when they're caught using drugs, it's usually testosterone. Now, there are a lot of banned substances.
True.
And the reason that they are banned substances is because a person may use a performance enhancement substance. For example, you could take, let's say, cocaine
Right.
and run faster than you normally would run.
True.
Now, cocaine is an illegal drug, but it could also be used as an enhancement. There are even some cough syrups that you cannot use prior to performing. So there are many things that you can't use. But once you're using testosterone and your blood is taken, a scientist who is versed in that field will tell you whether this person is using testosterone or not.
Right.
So that's a given. So individuals who are diabetic, have high cholesterol, hypertension, and other things, what happens is because of the debilitating effect it have on the body, and also the worry that you have because of this, it tends to drop your testosterone. So I want persons out there to understand that once you have diabetes, you are going to have sexual dysfunction. It may not happen right away, and it doesn't happen to 100%. Like everything else, it may not happen to every single person, but it will affect the majority.
I totally agree. And then too, you have a lot of diabetic patients. With that increased stress, they will also produce more cortisol. And
Correct.
cortisol, we know, the stress hormone, and that will lead to further debilitation of the patient. Again, that's why we look at treating the total patient now, because long gone are the days where you just treat a specific problem and not look at the underlying issues that created that problem. Today now, we're actually looking at, again, building the blood vessels. Just to explain blood vessels, those are like the pipes of the body. Yeah.
Yes,
And
circulation.
Circulation, yeah. And then the nerves, those are like the circuits or the electricals of the body. Just to let our listeners understand a little better. And why we use this comparison is because most people understand how a house works. You have to keep your house clean. You have to take care of your plumbing, take care of your electricals. Your body is more or less the same thing. Yeah.
Well, there's an equivalent. If you have a motor vehicle, you have to make sure you put oil so there's proper lubrication.
Exactly.
You have to have that circulation of fuel. You have to have everything working at an optimum level for things to work well.
Exactly.
So it's the very same thing with the body. The body has equivalents. There are things in your body that, as a matter of fact, the engine was designed based on the human body.
Mm-hmm.
The very same thing with, if you look at it now, the things that has to be done to engine
It's just
has
like
to
a
be done to the
human-
human
yeah,
being.
Exactly.
So you've got to have all these things working properly.
Yeah.
And once something is affecting the circulatory system and the nervous system, you're in trouble.
In big trouble.
No,
Yep.
I tell people this, and I want you to understand this, because I tell persons, your sexual system is your security system that God gave you.
Okay.
You know, like when you
What do you mean
go
by that?
and okay, when you have a house, you'll put up your cameras, you'll put up
Right.
your alarm system and whatnot. If someone should break the window, the alarm goes off.
Right.
It's the very same thing with your sexual system, and I'll tell you why. Anything that is going wrong with your body, the first thing that is affected is your sexual system, because you're paying attention to that all the time.
Very true.
It is what you are, and most men are supposed to wake up with a morning erection. Now, a morning erection is not a pee stand. A lot of times that's
There's
a
a
common
misconception.
word that we use in Trinidad. A morning erection is actually an indication of your testosterone levels
At that point.
at that point in time. It's the highest in the morning, and it's only high because you have gotten a full night's rest.
So your human growth hormone has dispersed throughout.
Correct. So in the morning now, you wake up with a morning erection and you feel good. That's an indication that the alarm system is working good. You test it in the morning,
Yep.
and you can go through the day. That's what it is.
It is, I agree.
But if you start waking up in the morning and you don't have a morning erection, it's an indication that something is going wrong with your circuitry.
Of course.
Something is going wrong with your delivery of
Especially
things.
if it's going on for days and days. Yeah.
Correct. So most men, if they pay attention to their bodies, they will understand that, wait a minute, I am having this problem. I cannot be aroused as I used to be. So something obviously is wrong.
Yes.
So let's take the step now to fix it. What are the steps? Find out through a medical report what's wrong.
Exactly.
Go
First
to a
step is
lab.
get tested,
That's the
yeah.
first thing. Get tested. Check your liver function, your kidney function. HbA1c, and
Your
all these
thyroid
things.
as well,
And your
too,
thyroid.
yeah.
Yes. And now you'll have a clearer picture. I tell guys, once you've crossed 30, go and do a testosterone test and a PSA and keep it.
I agree with that 100%. Because
And-
right now, prostate cancer is the leading cancer in men insurance.
Of course.
Yeah.
Of course. And what you do, you keep that information. Don't put it on your phone because phone could lose. Get a filing system and keep it. 2 years down the line, do the very same test again. So you will know if something is going wrong. Now, if something starts happening to you, if you start feeling a particular way or you don't feel as aroused as you were before, obviously.
Something's up, man.
But
Something's
if
up.
you're going to a professional like myself,
Right.
and I'm the only sexologist that deals with it, and I'm going to say that openly. I'm not a urologist, I'm not a medical doctor, so urologists deal with kidney and bladder and
Yes.
whatnot.
When you want to get on dialysis,
Right.
they'll help you.
When you want to work with sexual dysfunction, you come to Dr. Raj.
Exactly.
But bring the information that you
Of
have.
course, yeah. Let us know what's going on. We'll give you the right treatment.
Correct. Somebody asks, Mr. Prashant, can Nutrisec work for diabetes and stress?
Right. Well, the product Nutrisec is you could actually get that at any pharmacy. The Nutrisec, what it does is that it breaks up the fatty tissues around the liver itself, and that's a big problem in diabetics, pre-diabetics, and especially persons who drink alcohol. A lot of persons, you would find that they accumulate a lot of fat around the liver. It's really simple to see if you do an ultrasound of the liver. If it's, you might get like patches of white, or if it's totally white, that means that there's a lot of fat. Encompassing that liver. And you can actually get liver cirrhosis as a result. If the ultrasound is totally dark, that means that there's full blood flow into the liver itself. Yeah.
No, that's one of the things that we're doing because we're giving you a complete diagnosis of yourself.
Exactly.
Now, how we work together, for those of you who don't know, because we are aware that diabetes can cause erectile dysfunction and sexual dysfunction among men and women, what the doctor and Prashant has to do, they do their stuff. Then it's passed on to me, and I do my stuff to bring you back.
Exactly. Team effort.
So we work, it's a synthesis of both. It's working in tandem, but you are the front peddler, I'm the back peddler. Now, although some persons come to me first, now, earlier this year, last year, we didn't have this. We didn't have the synergy. We have the synergy now. And I can see how this could be much more important to deal with and to deal with my clients because I know the extent my clients suffer. And I know how many of my clients are diabetic.
And a lot of the clients too, they may be taking various pharmaceuticals. In fact, they may be moving from pharmaceutical drug to drug, and they may not even be aware of the possible side effects. What are the correct dosages? In fact, patients these days, they tend to get fed up of taking all these drugs. As well too, they may also develop other complications. So hypertension is a common thing that we see with diabetics developing later on. They can also develop eye diseases as well too.
Retina.
Retinopathy, yes, diabetic retinopathy, very popular in Trinidad and Tobago. I was actually at the couple eye clinics as well, and they're flooded with patients, and it's just scary for me as a young person too to see that so many older persons, because we appear to be having an aging population as well, but so many persons in this country, they're not getting proper healthcare, and no one is teaching them as well to what are the right things to do, and there's no one they could actually reach out to as well. You know?
I want to deal with a question that was, well, a statement that was made here. Some people claim that morning erection is when your bladder full and pressing on your prostate, hence what they say is a pee stand. Well, if that was true, every time you needed to pee and every time your bladder was full, you will get a pee stand?
Yeah.
Why don't you get a morning erection throughout the day?
And then when you urinate, your stand will go
But
completely.
yeah, but not only that. Don't we have full bladders sometime during the day where we can't keep it up and you got to find a lamppost or some kind of thing to do it up? I'm not advocating that because I don't like that.
Of course, yeah.
But what I'm saying, that's what people do.
Right.
But they don't have an erection. So that is a total fallacy, Mr. 8609. So whoever says that, they have no idea what they're talking about.
Of course.
And there are many fallacies in the things that we say in Trinidad, you know.
Of course. That's the thing about healthcare in Trinidad. Everyone has their own thing, you know, even doctors as well too, as far as what I've seen. Well,
I'll tell you one of the things that happened to me as a young man. young person, curious, asking questions of your friends who are much older than you, and asking them certain questions because things are happening to you.
Right.
And they're giving you their interpretation of what's happening to you based on how they want their experience and how they want it to be.
Right.
And you only, I come to the realization very early, and this is preteen years, that these fellas don't know what they're talking about.
Maybe they think you might find the solution and help them later on.
Well, that's what I did.
Yeah.
But they had no idea I was doing that.
Right.
What they remember, when men talk, they talk with their ego.
Oh,
For example,
yeah.
if you and I were to walk into a room and you tell persons, this is Dr. Raj, the sexologist, the first thing you'll hear coming out of most men's mouth is, I don't need him. I know everything about sex.
Mm-hmm.
That's the first thing, because it's ego talking. It's
And
not reality.
And usually the ego would actually mask the insecurity, at least from what
That's it. That is what it does.
Yeah.
It must. Well, every time somebody says that, I say, "You're well insecure." With It's like, you know, there are some guys. If their wives are talking to me, well, trouble. They get.
Not to that one.
I'm telling you, because
Yeah.
they get totally intimidated by that.
And it's just regular conversation too. It's not to say you're talking anything.
No. But
You know.
the reason why is that they may think that their wife is telling me something about them,
Right.
and no man likes their business talk
course.
outside.
Yeah.
Or why is she carrying on that conversation with him? Boy, he's
And-
the sex doctor.
Also, too, it could be maybe, I'm not saying for sure, but maybe his testosterone levels could be lower as a result. That's why they could be experiencing that type of insecurity. Do you think there's a correlation?
Yes, well, once you stop feeling like a man and being a man, insecurity steps in. You know,
Right.
there's a correlation. You see, the brain does something, which is controls everything.
Mm-hmm.
The brain, and it's not a one-way circuitry.
No.
It goes both ways.
Always, I would say.
Correct.
Sometimes,
Always.
yeah.
Always. Right. So if a man starts to fail being a man, that is telling the brain, hey, you're not a man, you know.
Yeah.
And the brain is telling it, well, I don't know what to do, you know.
Well, if I'm not a man, then what am I?
Yeah, well, I don't know what to do. I'm in trouble.
Yeah.
So
And then it tries to compensate, you know.
overcompensate.
Yeah.
And one of the things we do for overcompensation, as my host might know, is that some guys look for a younger person. You'll see that happening. No, that's
No, it is.
something that happens.
I've seen it many times. Yeah.
Midlife crisis or andropause causes that. That's why you see a lot of older men with younger girls.
girls, yeah.
And sometimes women go crazy for that. They wonder why this is happening. But
Right.
it is a mental thing.
Mm-hmm.
It is actually your brain telling you need a different sort of stimulation.
Yeah.
So you're looking for that stimulation from what you feel will give you the stimulation until you fail. And when they fail now, they say, she take all my money and go on. Right? But it's not her. It's you failing
Right, yeah.
as you go along.
And that's why the total wellness of the body, psychologically, physically, and spiritually as well too. You want to have all these things in order.
Well, I always believe in marrying all of those things. I believe in marrying your spiritual side to your physical side, to your mental side, and to your medical side.
And this means across the board as far as religions. Muslim, Hindu,
Well,
Christianity.
spirituality has nothing to do with religion.
Well, true. Just for all listeners
Yeah,
as well. To be
I
fair.
want persons to know that. Put religion aside, but your spirituality has to do with your inner self, your
Yeah.
core being,
And your
your
relationship
soul,
with your creator.
and right,
Yeah.
whatever that creator may be, whatever your belief may be, it doesn't matter. And that's what I try getting into people's head. That sometimes they think that you need to belong to a particular faith to have spirituality, but you could have spirituality without actually following a faith. But there are certain things, for example, if things are rooted in love, how you treat your fellow man, that is spirituality.
It is.
That is being a better person.
And that's why too I really like learning about the human body as well, studying anatomy and whatnot, because when you actually look at how intricate and how well put together the human body is, it really is a gift from some incredibly intelligent being, honestly. It really
Well, it has to be, because everything is in its right place.
Exactly. Yeah.
We don't have anything out of place, you know.
Yeah.
That's why it's, one of the questions that are brought to me is, should I be circumcised? And my answer to that is very simple. And this has nothing to do with religion or anything. If your belief system demands of you that you need to be circumcised, by all means, because that's your belief system.
Right.
But there's no need for someone to be circumcised, because there are 12 functions of the foreskin. And I say it very simply, God did not make a mistake. There's no mistake by God.
And when you compare our physical beings to animals as well too, We're very well endowed in comparison.
That's a fact. Can you give some info on how to find your partner's G-spot? Finding your partner's G-spot is very easy. It's one of the easiest thing to do, providing that you know what to do. Like everything else,
Of course.
information again.
It's a set way.
The G-spot is located inside of the vagina, approximately 1 inch into the vagina at the roof of the vagina. It's not inside of the vagina like this, it's at the roof of the vagina. So if you take your finger and you put it at the roof of the vagina, you'll feel something like a 1 cent piece.
Or
That
something
area,
like a
it's
spongy kinda-
it's kind of rough.
Yeah.
But as you play with it, it gets ribs,
Mhm.
striations, what you call striations,
Right, it must.
and it gets tougher. And as you play with that, the woman is going to react it because the G-spot has a lot of nerve endings.
Exactly.
Now, this is something that a lot of persons don't know, but I'm going to say it. On the penis head, and you know the size of a penis head, has 12,000 nerve endings. On a clitoris has 24,000 nerve
Yes.
endings. And it's much smaller than a penis head. So you could imagine the sensitivity of a clitoris in a woman.
yeah.
And there is no known reason for the clitoris in a woman other than for pleasure.
Of course. And that's where a diabetic female as well too would
Have problems.
experience-
That's what I was
yes.
coming to.
Yeah.
A diabetic woman would not have orgasm, would not feel with the way she's supposed to feel when it comes to sex. Because the nerve ending to this small little protrusion that she has
Yes.
gets damaged.
And
So she can no longer.
circulation is poor,
Now,
pipes, yeah.
there are treatments that we use to bring back that feeling. There are things that we do.
Right.
But to cure the problem or to eliminate that problem, that's what you all do.
Right. Well, as far as diabetes is concerned, we acknowledge that there is no real cure per se in the medical sense of terms. But what we offer is a true management system or protocol that we can actually allow you to reduce or eliminate all the complications of diabetes. Now, what are the complications of diabetes? Diabetics tend to have nerve issues or nerve ending damage to the feet especially. You probably heard of the diabetic ulcers as well too.
Correct.
I was doing a presentation earlier today at a company and they were shocked to see that 20 years ago there were approximately 200 amputations per year. But last year it said that we crossed 500, moving towards 600 amputations. Our hospitals are filled with persons having their toes and feet cut off. Now what does that mean?
Well, it's easy to do that.
I agree, it's a simple surgery, but it's really unfortunate because what are the other complications that these persons are having?
Phantom pain.
Phantom pains, constant damage to their eyes as well too. There's probably some kind of optic nerve damage, and that's the thing. They don't look at the entire patient, and then to the male patients especially, all they want to know is what you can do for me. What can you really do for me?
What can you do for me down there? Good evening, doctor. My last period was 26th of January. Since yesterday, my breasts are very painful to touch and it feels softer. What can this be? It's some sort of sensitivity. It might be that you are very close to your period. Some women have periods that are out of sync because of hormonal imbalance. So you have to be aware of that. And I always tell women to document these things. Document it, write the date and time, do it for 2 or 3 months, and then seek professional help. Because when you seek the professional help with the information that you have,
Right.
then the person can assist you.
I believe there's an app as well too you can get on your phone.
Yes,
Free
there
app.
are apps for that. I want to know if this woman loves me. Well, not me. She's 24 and I am 61. She told me she loves me. I used to send money for her, but I stopped to see what kind of person she. She tell me to leave she alone. What should I do? She giving you good advice. Leave she alone.
That's why we need to listen to our women and take their advice, right?
No, but in a situation like that, it is obvious a 24-year-old woman telling a 61-year-old man, and I don't know if there's physical interaction, meaning
course.
if they're in the same room, sitting across from one another.
Right.
There's a lot of scam on cell phones
Yes. I
and
agree.
social media.
Social media, yeah.
A lot of scams. And one of these days, I'll sit here and call out all the persons who are scamming. I know I'll do it, because there are individuals out there who do that for a living. I have the names of these individuals. I have their numbers. So I'll give it to the persons out there, especially those who are contacting you from overseas.
Oh yeah.
Watch out for them.
They're scary.
They're very scary. The ones who want to put money into your account, They want to put millions of dollars into your account,
But you have to
but,
deposit
but you have
tomorrow.
to deposit $10,000 for them to do it. My thing is take it out from the $10 million. That's what I tell them.
Right,
I say, well, no problem. You can send it
take it
all
out.
to me. Just take it out from the 10 million.
And then they just say, they just get confused.
You
You
know,
know?
they get confused. Exactly.
They don't know how to
It's like
respond to that.
if you are a housewife, for example,
Right.
and you're constantly getting calls from someone who is telling you unpleasant things, that what they want to do to you and whatnot.
Right.
If you turn it around and tell the person, yes, I want you to come and do that now, and if you do a good job, I'll beat you, that person will never call you again,
Of
you know.
course.
Because now they become on the defensive. But not much women have that fortitude to do that.
That's the insensitivity coming out there, you know. It's actually a good thing.
So the whole operation or the whole thing that we're doing is that correlation of what we need to do with the scientific side or the medical side,
Right.
with what needs to be done. I deal with the physical, some of the emotional, the environmental factors, because there are lots of environmental factors, and even having a disease is part of the environmental factors, because think about it, your partner has to work differently or do things differently for you.
Exactly.
Even diet.
Especially with a chronic disease like diabetes, you'd find that your entire life tends to center around this condition. You have to monitor your blood sugar constantly every day.
Everything
and-
changes.
Yeah, a whole-
Everything changes.
The family as well too has to be aware that there are possible emergencies as well, especially in cases where patients go into hypoglycemia. So what does that mean? That's when the blood sugar drops a bit too low. A person could actually go and progress into a coma with that. And then there's a reverse of it, hyperglycemia, which is where the sugar skyrockets.
Skyrockets, yes.
Especially after eating a very nice, sweet, sugary something.
Especially those who like their desserts after every meal.
Oh, dear.
And that's not a good practice, eh? It's not a good practice to have desserts after
And so
every meal.
late at night too,
Because-
before they go to bed.
Now, one of the bad things about our diet, if it falls in your garden, I'm sorry, is that we carbohydrate with carbohydrate. You know.
Yes. On top of sugars are right.
Well, no, the sugar coming after. I'll give you a very good example, which everyone here, it might be their favorite. Roti and fry aloo. That's carbohydrate with a cup of tea, sweetened with condensed milk and sugar.
Or you sweet rice after every puja.
Well, I treat a lot of pundits, a lot. And first thing we talk about is changing their diet. And I have had a lot of pundits who have treated. I hope this doesn't sell them out. When they go to pujas and whatnot, they ask for salad alone, you know.
Right.
That's what they ask for, you know,
Fantastic.
only for salad, you know. And there's people like, but Baba, you have to eat a piece of roti. I don't have to eat it because I can kill them. You have to be careful about these things. Very careful. So remember, you can WhatsApp us at 2994103, 2994103, or you can actually call us at 6284108. My operator is standing by. Oh, 4103, sorry. 6284103. How could I forget that? My operator is standing by and he has nothing to do. So let's give him something to do. Good night, doctor. Question: can masturbating get you sick? No, it cannot get you sick unless you overdo it. Overdoing anything can cause you might just get weak and want to fall asleep, but it's not going to get you sick. And you don't grow hair in the palm of your hand. Let me see your hand.
Nothing there.
You don't go
Maybe I'll keep
blind.
it off, who knows?
You don't go blind from masturbating. So all the guys who wearing glasses, not because of over masturbation. There's so many false things out there. Masturbation is natural, and let's be serious about it. It has been found that the fetus in the womb masturbates. So if someone should say masturbating is a sin, and a child is born without sin,
What's really going on there?
what's really exactly?
Yeah.
It leads you to think a child is supposed to be born without sin,
Pure
and right, pure and whatnot, and you have the fetus in the womb masturbating. So masturbation is natural. It's just that we frowned upon it because we think it is an unnatural act, or we think that the person shouldn't be doing it because it's sexual. That's all it is. But it's a natural act, and if you feel to engage, of course, make sure you do it in the comfort of your privacy of your home,
Yes,
or wherever. You don't do it in public.
of course.
Don't go behind the house
We frown
for the
upon
neighbor
that,
to see you,
yeah.
because now everybody have phone. They're going to film you. They're going to put it on social
And you
media.
end up on news. So.
So, like everything else in life, you have to be very careful of what you do. What could you do to thicken your penis? Thickening of the penis has to do with vasodilation.
Right.
There are vasodilation creams that you could buy to apply onto the shaft of the penis and the head of the penis that helps with thickening. But if you want to do anything like that, you must use a pump. Why? Circulation,
Right.
pulling more blood, breaking down the tissues. Why do you go to the gym? When you go to the gym and you work out, what you do is break down tissues, you know.
Exactly.
The cells break down, they multiply. You have to feed the cells, of course. Some persons go to the gym and don't take supplements. That's a no-no.
Yeah.
Because all you're going to do is remain stringy and hard, and you might gain some strength, but you're going to reach a sticking point.
And also too with the diet as well, even if you're eating a perfect diet, they're still gonna need certain areas that you would have to compensate. That's why with the treatment as well too, our treatment is totally supplement based. So while we would look at changing your diet, exercise as well, we would like to actually increase your own stem cell production as well too, your natural stem cell production through our supplement.
I think we need to explain the stem cell thing,
Sure.
because a lot of persons are confused by stem cell. When they hear the word stem cell, they feel you want to operate on the brain stem and take out something. But all cells have a makeup of it.
Exactly.
And when you start feeding that, it starts to multiply.
Exactly.
And that's the basis of it. That's the basis of stem cell.
All the cells in your body at one point in time, they were stem cells.
They were
Yeah.
stem cell, exactly. And rejuvenation comes about.
Exactly. It's just that as you age, as well as diet, exercise, or I should say poor diet, lack of exercise, and as well as the elements as well too, we don't take into consideration our environmental factors as well. So what we look at is actually nourishing your body in a way that you are actually able to increase your own natural stem cell production. And that's how we basically get patients to have such great results.
Like I had a patient come to me recently, and he came with his wife, and the wife was telling me certain things, and I'm asking him, what did you do wrong for you to have these? So he's asking me.
Right.
Now I have met this person for twice,
Mm-hmm.
and he said, Doc, what went wrong? Why is my levels and all these things are so bad? I said, Brad, you have to tell me your lifestyle. And then the wife starts. Well, he does this, he does that, he does. I say, well, okay. Is he doing this, that, and the other, especially dealing with chemicals?
Right.
Once you, for example, if you're working in a service station,
Right.
you're pumping gas, you're inhaling that fume
Those fumes.
all the time, it's going to do something to you. It's going to do something negative to you. A welder, a painter, automotive painting especially, because you're in this cubicle. You're not outside in the open, you're trapped.
Yeah.
You're trapped with the fumes. You can have whatever extractor you want or whatever you have there. Whatever gear you're wearing, it still penetrates.
And the thing is, it's going straight into your bloodstream, and it actually stays in your lungs as well.
Directly. Is it true that having plenty sex leads to weight loss or can contribute it? No.
Well, depends on what you consider plenty sex.
True, but plenty sex will not do. You don't burn that amount of calories with sex.
True.
Let's just face that. Sex is very pleasurable.
It is.
All aspects of it, whether it be oral, digital, or any other way. But you don't burn that amount of calories to lose weight.
Yeah, it's not like going at the gym and working out intensely.
No, it's not that. And some persons will say, well, my heart does race and I'm sweating too bad. It might be, it might
that's
be,
probably true,
and
yeah.
it might be that the fan in the room may not be hitting the right place. But one of the things I always tell persons, and this is important to note, if you have a fan in your room when you're having intercourse, do not have it blow directly on you.
Okay.
Make sure it bounces off a wall. 2 reasons. It can cause you to get sick, or it dries you up very quickly. So the
Oh,
woman
okay.
needs extra lubrication, the
Right.
man needs extra lubrication. Never let a fan hit you
There's
directly.
a drying factor to that.
It's a of course, fan dries out things very quickly. Especially
That
if
makes sense, yeah.
fan does not cool down anything. It circulates hot air.
Right.
That's what it does.
Yeah.
So if the room has a certain temperature of air, what the fan does is take that air and throws
move
it
it
directly
around,
to
yeah.
you. So if it hits the vagina, it hits the penis, it dries up everything very quickly.
And then too, you have these two beings generating heat. So a
Well,
constant
that
cycle of-
that is part of it. But dry air in a room blown by a fan will cause more drying effect on the vagina and the.
So imagine we have a combination effect of dryness constantly happening there.
Well, you don't want that.
Of course not. But that's the thing. There's a lot of complications again with respect to sexual health and diabetes. You would find that even cases like that too, women aren't able to produce the amount of lubrication naturally as well, as a result of the husband or possible partner trying to stimulate constantly, and they're just not getting anywhere.
But one of the problems that you find is that a lot of times you don't drink enough water, and you're expelling. Lubrication is water.
Right.
The main ingredient in lubrication is water. If you don't drink enough water, you're not going to lubricate enough. And I've had many persons call me, and when I ask them about their water intake, well, I don't like to drink water. That's what they'll tell you.
Wow.
Or they'll tell you, well, I just drink enough soft drink or juice.
Okay.
That's not water.
Try driving your car without gas. You'll see how it goes. Right?
Exactly. Water is an essential element of your body. We are made up, 75% of our body is made up of water. And if you don't put the amount of water that you need. Now, I'm sometimes guilty of that because I work in an air-conditioned room.
Right.
So you don't feel the need to drink water. But one of the things that I find myself doing is that I keep water on my desk, keep it in a container, and I'm always sipping. Because water is very important.
Well, as compared with diabetic patients as well too. A lot of them get what we call dyspnea, which is where they're constantly thirsty. And they also have frequent urination as well too. So you have a cycle of water coming in and flowing out really quickly. This also puts a lot of pressure on the kidneys as well too. You have constant filtration and then expulsion of these fluids. It's kind of scary as well because currently we have over 1,000 patients on dialysis. And
I know. We have a high percentage of patients in Trinidad and Tobago on dialysis.
And the majority of them are diabetic. The governments, well, I don't want to say all, but they have a prerogative too that it's not going to get any better as well. In fact, King's College of London actually said even if all governments in the world actually hit their targets for reducing chronic disease, it's still going to increase by 88% in the next 10 years.
I don't doubt that at all.
Yeah.
Good night. Why do you get a much fast? Why do you come? Oh, they spell come C-O-M. It's supposed to be C-U-M.
Right. So
Much faster when you have sex with someone or else, I guess, is other than your regular partner. Well, premature ejaculation that's an excuse, you know. If that person says that is an excuse, he's a premature ejaculator.
Right.
Premature ejaculation is premature ejaculation, and it doesn't matter who you're having intercourse with. You know?
Right.
If you're having intercourse with let's say your spouse, and you ejaculate within 10 minutes, and you go with someone else and ejaculate within 5 minutes, you're still a premature ejaculator? A premature ejaculator is a person who ejaculates before they can satisfy their partner. Normally it takes 20 to 25 minutes to satisfy your partner. So premature ejaculation, what happens is that the oversensitivity and the anxiety of being with someone new will cause you to ejaculate the same way,
Right.
but it's in your mind it is faster, but you are a premature ejaculator.
So is
Any person who ejaculates without satisfying their partner, because there are some women who are satisfied in less than 20 minutes, and they want their partner to ejaculate with them. That's all well and good.
Yeah.
But that's providing you have control and you could ejaculate when you want to.
True.
And that's something we teach at the Adult Therapy Center. I've been teaching that for years. How to control your PC muscle, the pubic muscle, to prevent you from ejaculating before your time.
Exactly. Is this person guilty of being a greedy lover, you think, Dr. Raj?
No, anxiety, that anxiousness, or the fact that I've finally gotten this, I've finally captured what I need to capture.
Right.
So remember the WhatsApp number is 299-4103, 299-4103, and the number to call is 628-4103.
Fantastic. So, no more messages?
Yes,
Or-
we have something
or
here.
Something coming in?
Is using saliva a lubricant safe, or should you use a water-based lube? Well, if you have bad breath, it's not safe. No, seriously.
I totally agree.
No, it's not safe.
Because the bacteria...
Halitosis is bacteria that comes from your stomach. And even a woman who kisses a man with bad breath, or a man who kisses a woman with bad breath, you're passing germs to one another. Serious germs. There are more germs in the mouth than on the penis or the vagina.
And That's not the fluids you want to pass, guys.
Right, you don't want to pass that. Secondly, saliva is not a very good lubricant. Because for the simple fact that saliva is something that dries up very quickly, it's easily absorbed by the body. So it's always good to use a lubricant. There are different types of lubricant. There are water-based lubricant, and there are natural lubricants, and there are silicone-based lubricant. The best lubricant to use, but it depends on what you're using it for, maybe a silicone lubricant, depending on the person.
Right.
If the person gets chafing or cuts or bruising of the vagina or whatever part they're using, you need to use a silicone because it creates a sheen or a film over the vagina or the penis.
Okay.
The natural lubricants is a mixture of both silicone and water.
Right.
So it has the same viscosity as silicone, but it's easily absorbed and it dries up faster.
Right.
Water-based has its place, but you have to use more water-based.
Well, that's fantastic.
WhatsApp 2994103,
And of course, all
and you
these
could call on
products-
2994103
Of course, all
also.
these products are available at Total Image.
At the Dr. Raj Adult Boutique, of course, for those of you who don't know, I have two adult stores, one at Babu, number 3, Valsade, one at Debe, and of course, Total Limit has everything. Anything you want regarding sex, you find it at Total Limit. Hi, good night. How do I increase testosterone level? First of all, you have to be diagnosed with low testosterone level. Secondly, don't go buying a tablet to raise testosterone level because tablets does not raise testosterone level. You cannot ingest anything to raise testosterone level. Some persons will ask me, what are the foods I could eat to raise testosterone level? There are foods that you can use to maintain testosterone level, not to increase it. And some of the foods are, and I'm going to call it out, so if you want to write it down, you could go ahead and write it down. Asparagus, celery, you notice those two things are shaped like a penis.
That's true.
Right. Avocados. Look at the shape of it.
Oh, well.
Almond nuts.
Walnuts. Yeah.
No, almond nuts.
Okay.
Almond nuts. Not any kind
Not
of
any,
nuts.
yeah.
Almond nuts. There's
Is
a
it-
big difference.
Is it the omega-3 fatty acids in it? That's
It has to do with that.
Okay.
Then you're looking at salmon fish. Salmon fish again because of the omega-3 fatty
Another good
acids.
source, yes.
Right.
Which is also part of our treatment as well.
Well, of course, that's why I'm bringing these things in so you could talk. I'm giving you a chance to bring in your stuff.
Great. All right,
Right?
so as we mentioned before, part of our treatment is not just the nerve regenerative therapy, but also the stem cell therapy. But it's not just the average stem cell therapy where you'd probably hear about persons moving cells from one person to another or stem cell transplants. We don't advise these types of things. Why? Because they're very, very expensive. And also, to a lot of these situations, you find that 50 to 70% of the cells actually die off in transit. So it's very expensive overall. What we realize is that the human body has a lot of fatty tissue in it. And in terms of actually using stem cell products, there are a lot of stem cell products on the market. But because of this fatty tissue, the nutrients are not able to be absorbed properly into the body. Why we're using a stem cell component together with an omega-3 fatty acid is because these are fat-soluble nutrients. So as a result, your body will be able to absorb it much, much easier, especially if you're diabetic. Diabetics tend to have a little extra weight, sometimes a lot more. So that's why we tend to use this to rebuild the blood vessels and then repair the nerve damage as well.
Somebody says, hi, it's me again. I don't know who is me. Hi, it's me again, which means that my regular partner does not come when I have sex with her, even after about 15 minutes. You have to find out that from your partner. Most women fake it, you know. Most women fake an orgasm. It's a standard thing. And for the person who is sending voice notes, please don't send voice note. Call. You can call the 2994103.
Yes, we'd love to talk to you.
2994103 for those of you who want to call in. Of course, we have just a few minutes again. Oh, 10. We have plenty time,
Wow.
man. We have
We
enough.
have a lot of
we have
viewers on
enough time to.
Facebook, Dr.
We have enough time to play a test match.
Yeah, so special shout out to all our Facebook fans.
Yeah, we have a lot of Facebook fans. I'm happy to see that. Thank you very much for those of you who are
Fantastic.
tuning in. I see the doctor is in the house. My good friend Checky is in the house. Ziad, Nish, all these persons here. We have a call coming in too. The call gone.
Well, call back, please.
Call back. I think my let's see.
Oh,
Hi,
good
good
WhatsApp.
night. We got a WhatsApp here. Guess all the ladies tell you that. Okay. Yeah.
That's an R-rated one.
That's a personal one. That's a personal one. I have to be careful, because sometimes these ladies they slip in some comments and things here and there, and sometimes I'm in my excitement to read it out, it flies out. Let's take this call. Hi. Go ahead. We're listening. For those of you who want to come into the clinic, and you could take this number down, you can call 645-4543 and tell them you want to make an appointment to see us at the clinic for diabetes. The doctor would be there on Wednesday, and they'll have the holding consultation, telling you or the whole protocol and everything, and you decide from there. For those of you who want to visit for diabetic problems, call 645-4543. That's my office number, 645-4543. Make an appointment and come in. Or you can send a message on my cell phone also, 740-1961, and we'll take it from there.
Yeah, definitely. I think in that situation, we can definitely be of assistance and get him back on track.
Person says, as a Hindu vegetarian, can I eat fish, seafood? No, if you're a vegetarian, you don't need to eat that. You could get the almond nuts, you could get sesame seed. There are a number of things that you can use to get the omega-3 fatty acid.
Supplements as well.
And there are supplements that are vegan friendly that you can use also. Hi, my boyfriend, he can only go once. When he comes, he can't do anything again. That's his refractory period. His refractory period is very low. Any man who cannot make a second wrong, it's because of their refractory period. That needs to be looked at. It all depends on other information, like for example his health, his age, the type of work that he does. That will determine his refractory period.
So environmental factors.
Environmental factors. Good night, panel. Question: I don't have feelings for sex at no time. Where do I go wrong for the 3-year-old? Where in South can I see you? You can see me at the Debe office. I'm at the Debe office on the 19th of this month and then next month. So you can call the number at the Debe office. I'll give out that number in a few minutes. You can make an appointment, come in there to see me. Again, I that's why I opened a South office, because I've had a lot of requests for persons to come to this to see me in South, because some persons just don't like coming to the North.
I agree. We're also opening our office in South as well, so we realize that it's a heavy diabetic and chronic disease population.
Well, of course, you all will be using my office at Debe also.
Of course, yeah.
So, this number is 366-5843. 366-5843. That number again. Good night. Okay, that is that question. Good evening, Dr. Raj. Is it normal for a man to get turned off during sex when the woman becomes wet? Yes, some men are turned off, but it's not normal. That's not a normal thing. So it must be a reason for that. Some men, because a woman over lubricates, they don't feel the friction that they're supposed to be feeling, so they lose the desire to have sex. That's why there's something called a hair clot. You know what's a hair clot?
Never heard that before. I'm too young for this.
You don't know what's a hair clot? When they finish have sex with somebody, you say hair. You give them a clot to wipe up. It's a subclot. No, but you can putting all joke aside, move aside. Yeah.
No, that's okay. Yeah.
But you you can get rid of some of the lubrication by using a towel or a washcloth and continue. Okay. If that's what's happening, because it has to do with the friction that you get from the vagina.
Right. So men would really want that type of constriction as well.
Constriction and friction. Because some women, when they get wet, they start the inside of the vagina starts moving. There are women who are super, and when that happens, it pushes the penis out also.
I agree.
Good night, watching from Toronto. Thank you very much. My good friend Mark Budram is on. Mark, we're on here every Monday. For those of you who want to know, we're here every Monday from 7 to 8. I live in Canada and I am diabetic. How can I... And I have high blood pressure. You can call the Adult Therapy Center and
Sure.
On Wednesday, they could call and talk to the doctor.
Of course. I mean, this is becoming, or I think it would be a global show now. We have audience members from all over the world. So, and diabetes is present all over the world, especially in the United States and Canada.
Well, I do have a following all over the world, because I'll tell you something. When the governments of this country have been talking about medical tourism, I have been doing that for the last 15 years.
Of course.
I have persons coming from all over the world because of cricket. They know me through that.
Right.
And they hear about me because some of the cricketers talk about me and whatnot. And they come here to Trinidad just for treatment for sexual dysfunction.
Mm-hmm.
There are many times I write to immigration to allow them to come back often for
repeat
treatment, repeat treatments.
And that's the thing, our treatment as well too. We try not to be small-minded. We look at a holistic treatment and treating persons. We're really looking to go global one day and actually have persons benefit from our treatments, because again, it's a global problem. We have over 400 million diabetics in the world today, maybe even more, because I find that statistics tend to be a bit off sometimes.
Especially in Trinidad, because people are afraid to speak to persons from the CSO office. No, that's a serious problem right now.
Census issues.
Census issue. The number again, let's just take this number, 645-4543. Call that number and they'll give you all the numbers you need. If you want my personal number, they'll give you my personal number, my 740 number. If you want the number for the Debe office, they'll give you the number for the Debe office. Just simply call 645-4543 and you'll get all the information you want. And you could call them now. They're open.
Open for business.
Open for business. When a woman gets too wet, does that cause the woman's vagina to make a... Yes, it does. You get a sound coming from the vagina. It's called a prephem. That is air moving against the lubrication in the vagina that causes the sound.
Oh, we call it a queef.
Queef too. Yeah. So, again, for those of you who want to get in touch with me, those of you who want to make an appointment to see the doctor on Wednesday to get your consultation and all those things done, the number again is 645-4543. It's a very simple number. You can call now. My office, not my office. The business is open until 11 at night, for those of you who don't know. If you want to find out my hours at the clinic, they'll give you that information. If you want to get my cell phone number, it's 740-1961. If you forget it and you call it 645-4543, they will give you the cell phone number. I have no problem in giving out my cell phone number.
Wow, we had a really fantastic audience today.
Yeah, really good. But I was expecting more calls.
Yeah.
But
I think we're getting a lot of WhatsApp and social media.
Social media, we have a lot of persons with us on Facebook. We had some questions coming in via my WhatsApp and also some coming in via the WhatsApp here. The question on the thickening of the penis and the lengthening of the penis, it all has to do with the pump, the vasodilation cream, and supplementation. Hi, good night. I'm locked on. McBean is locked on. So hopefully the whole of McBean is locked on. And I know we have a large listening audience on this station, 103.1. So we thank you all for listening to this program, for being part of Let's Talk Sex with Dr. Raj. Remember, I'm on every Monday night from 7 to 8. For those of you who want information on the diabetic treatment, call 645-4543. Good night.